In an era where environmental consciousness is paramount, understanding the quality of the air we breathe is crucial. The air we inhale every day has a direct impact on our health and well-being. Enter the Air Quality Index, or AQI, a vital tool for measuring and communicating air pollution levels. The AQI provides a clear and concise way to understand the air quality around us. Launched in India in 2014 as part of the Swachh Bharat Abhiyan, the AQI plays a crucial role in raising public awareness about air quality and its impact on health. It helps people stay informed about the air they breathe. The AQI simplifies complex air quality data into a single, easily understandable number, ranging from 0 to 500. This number indicates the level of pollution in the air and its potential health effects. The index provides a snapshot of the air quality at a particular location and time, helping individuals make informed decisions about their outdoor activities and health precautions. It is an essential tool for everyone, from parents to athletes, to understand when it is safe to be outside. The AQI is more than just a number. It is a reflection of our collective impact on the environment and a call to action to protect our health and well-being. By monitoring the AQI, we can take steps to reduce pollution and improve air quality. Understanding the AQI can empower communities to advocate for cleaner air and support policies that aim to reduce pollution. It is a tool that bridges the gap between scientific data and public awareness. By staying informed about the AQI, we can all contribute to a healthier environment and a better quality of life. It is a small step that can lead to significant changes in how we live and interact with our surroundings. So, the next time you check the weather, take a moment to check the AQI as well. It is a simple habit that can make a big difference in your daily life and long-term health. The Air Quality Index is a powerful reminder of the importance of clean air and the steps we can take to ensure a healthier future for ourselves and the generations to come. Let us all be mindful of the air we breathe and work together to improve it. The AQI is not just a number, it is a call to action for a cleaner, healthier world. By understanding and utilizing the AQI, we can all play a part in creating a better environment for ourselves and future generations. Let us take this knowledge and turn it into action. The Air Quality Index, or AQI, is a crucial metric used to communicate the quality of air in a specific area. It is calculated based on the concentrations of 8 major air pollutants: particulate matter, PM2.5 and PM10, ozone, O3, nitrogen dioxide, NO2, sulfur dioxide, SO2, carbon monoxide, CO, and ammonia, NH3. These pollutants are known to have significant impacts on human health and the environment. These pollutants are measured over a specified period, typically 24 hours, and their concentrations are converted into a corresponding AQI value using a standardized formula. This process involves sophisticated equipment and rigorous scientific methods to ensure accuracy and reliability. The AQI scale is divided into 6 categories, each representing a different level of health concern. These categories help the public understand the potential health risks associated with varying levels of air pollution. These categories are good, ranging from 0 to 50, indicating air quality that poses little or no risk to health. Satisfactory, from 51 to 100, where air quality is acceptable, though there may be a moderate health concern for a very small number of people who are unusually sensitive to air pollution. Moderately polluted, from 101 to 200, where members of sensitive groups may experience health effects, but the general public is less likely to be affected. Poor, from 201 to 300, where everyone may begin to experience health effects and members of sensitive groups may experience more serious health effects. Very poor, from 301 to 400, where health alert conditions are triggered, meaning everyone may experience more serious health effects. And severe, from 401 to 500, where health warnings of emergency conditions are issued and the entire population is more likely to be affected. Each category is associated with specific health advisories, ranging from minimal impact for good AQI to serious aggravation of heart or lung diseases and premature mortality in persons with existing diseases for severe AQI. These advisories are crucial for public health planning and individual decision-making, especially for vulnerable populations such as children, the elderly, and those with pre-existing health conditions. Diwali, the festival of lights, is a time for celebration and joy. Families come together, Homes are decorated with beautiful lamps and the night sky is lit up with dazzling fireworks. However, in recent years, the festival has also been associated with a sharp deterioration in air quality, particularly in Delhi. The extensive use of fireworks and firecrackers contributes significantly to this problem. The aftermath of Diwali 2024 was no different, with the city witnessing a significant spike in air pollution levels. The thick blanket of smog that enveloped the city was a stark reminder of the environmental cost of the celebrations. The AQI in Delhi on the day after Diwali soared to alarming levels, reaching the severe category in several areas. This was a cause for concern for both residents and authorities. The average AQI across the city was recorded at insert specific AQI number here, significantly higher than the previous year's post-Diwali AQI of insert previous year's AQI number. This upward trend in pollution levels is worrying and calls for immediate action. This alarming rise in air pollution levels raised serious concerns about the health of Delhi's residents, particularly vulnerable groups like children, the elderly, and those with respiratory illnesses. The thick smog not only affects visibility but also poses severe health risks, leading to respiratory problems, eye irritation, and other health issues. The need for stricter regulations and public awareness about the environmental impact of Diwali celebrations has never been more urgent. One of the primary contributors to the deteriorating air quality post-Diwali is the rampant bursting of firecrackers. While fireworks illuminate the night sky, they also release a toxic cocktail of pollutants into the air, including particulate matter, sulfur dioxide, and heavy metals. The fine particulate matter, particularly PM2.5, released from fireworks, can penetrate deep into the lungs and even enter the bloodstream, posing severe health risks. The smoke and smog generated by fireworks also reduce visibility and create an unpleasant haze, making it difficult to breathe. Section 5. Stubble burning, a seasonal hazard. Adding to Delhi's air pollution woes during the post-Diwali period is the age-old practice of stubble burning in neighboring states. Farmers often resort to burning crop residue after harvest to clear their fields for the next sowing season. The smoke from these burning fields travels long distances, carried by wind patterns, and significantly contributes to the smog and haze that engulf Delhi. The problem is particularly acute in the post-monsoon season when wind speeds are generally lower, leading to the trapping of pollutants in the atmosphere. Section 6. Vehicular pollution and industrial emissions. While Diwali fireworks and stubble burning are seasonal contributors to Delhi's air pollution, vehicular emissions and industrial activities play a significant role throughout the year. Delhi is a densely populated city with a high volume of vehicular traffic, contributing to the release of pollutants like nitrogen oxides, carbon monoxide, and particulate matter. Industrial emissions, particularly from power plants and factories operating in and around the city, further exacerbate the problem. These sources release a range of pollutants, including sulfur dioxide, nitrogen oxides, and particulate matter, into the air, deteriorating air quality and posing health risks to the population. Section 7. The silent killers, PM2.5 and PM10. Among the various air pollutants, particulate matter, particularly PM2.5 and PM10, pose the most significant threat to human health. PM2.5 refers to fine inhalable particles with diameters that are generally 2.5 micrometers and smaller. PM10 refers to inhalable particles with diameters that are generally 10 micrometers and smaller. These microscopic particles can easily penetrate the respiratory system, reaching the deepest parts of the lungs and even entering the bloodstream. Their small size allows them to bypass the body's natural defense mechanisms, making them particularly dangerous. Section 8. Health impacts of air pollution, a growing concern. The health impacts of air pollution are numerous and far-reaching. Exposure to high levels of air pollutants, especially PM2.5, is linked to a range of respiratory and cardiovascular problems. These include asthma, bronchitis, lung cancer, heart attacks, and strokes. Children, the elderly, and those with pre-existing respiratory or heart conditions are particularly vulnerable to the adverse effects of air pollution. Air pollution can also exacerbate existing health conditions, leading to more hospital admissions and even premature deaths. Section 9. Combating pollution. Government measures in action. Recognizing the severity of air pollution and its impact on public health, the government has implemented several measures to combat this growing concern. These measures include Graded Response Action Plan, or GRAP, implemented based on AQI levels. GRAP includes restrictions on polluting activities like construction, diesel generator sets, and truck entry into the city. Promoting public transport, encouraging the use of public transport, including the metro and buses, to reduce vehicular emissions. Electric vehicle policy, providing incentives for the adoption of electric vehicles to transition towards cleaner transportation. Monitoring and enforcement, strengthening monitoring mechanisms to track pollution levels and enforce regulations on polluting industries. Section 10. Conclusion. A collective responsibility. Addressing air pollution, particularly in a megacity like Delhi, requires a multi-pronged approach and a collective effort from all stakeholders. While government policies and initiatives are crucial, individual actions also play a significant role. Choosing sustainable modes of transport, opting for eco-friendly celebrations, and raising awareness about the impacts of air pollution can contribute to a cleaner and healthier environment. Protecting our air quality is not just the responsibility of the government, but a shared responsibility that demands our immediate attention and action.